Is
Go.
there,
Go.
okay. Alright. Alright, so hi, my name is Giovanna. I'm a nurse practitioner with Purdue University and or a student, and I'm here to do your heart and lung assessment. So can you tell me your name, your date of birth,
8/11/16,
your age,
18,
and your race?
Hispanic,
What are your preferred pronouns?
she,
Alright, thank you, Sulema. What brings you in today?
nothing in particular.
Okay, can you tell me if you have any allergies?
No.
Do you have any pain right now?
No.
Alright, now I'm going to ask you a little bit about your history regarding your lungs and your heart, okay? Do you have a family history of heart or lung disease?
No.
Do you take any medications?
No.
And I'm going to ask you a little bit about your habits, so can you tell me your diet?
So I go out once in a while, but I try to stay away from all of my the fried and greasy foods.
Okay, that's good. That's a really good thing to do, especially for your heart. Eat more vegetables, okay? All right, and your hydration. How many drinks do you have per day and of what?
6 to 7 cups of water a day, sometimes Gatorade.
Perfect. Do you exercise?
Yes.
Okay, how much do you exercise?
Go to the gym for about an hour, swim for about 2 to 3 hours.
Okay, wonderful. Do you do any drugs?
No.
Any tobacco use?
No.
Any alcohol use?
No.
All right, thank you, Sunema, for that information. Now we're going to move on to the review of systems. So we're focusing on the heart and the lungs. So for the heart, can you tell me if you ever feel like your heart skips a beat?
No.
Any flutters in the chest?
No.
Do you ever feel like you have abnormal heartbeats?
No.
Okay, and do you ever feel like when you exercise too much, your heart hurts or your heart skips beats?
No.
Short of breath? Or if you're sitting down, do you ever feel short of breath?
No.
All right, now how about for your lungs? Have you been coughing recently?
No.
Anything come out when you yawn, you cough? Any like boogery substances?
No.
Okay, and do you have any like anxiety attacks, any asthma attacks,
No.
any chest pain,
No.
any tightness of the chest? Okay. All right, now we're going to move on to the actual assessment. So I'm looking at the posterior of the chest. I'm looking for symmetry as she breathes normally. I see the shoulders rise and fall equally, so it's symmetrical, which is a normal finding. I'm looking at the skin for any lesions or any moles. I'm checking for any tenting, and means there's none, which means she's well hydrated. I'm also inspecting for a respiratory rate, which is between 16 to 18, which is also a normal finding. Her breathing is effortless. The rhythm is regular, which is also a normal finding. Now I'm going to inspect for AP ratio. So lateral to front should be 2 times the front, which is a 2 to 1. It's a normal finding. I am going to now look at the back of the chest, so if you can turn around for me. Okay. So looking at the back of the chest as she breathes, also symmetrical. I don't see any change in her rhythm, and it's effortless. I'm going to put my hands, my thumbs towards the spine, my fingers lateral, and as she breathes in and out, I'm looking to see that my thumbs go up at the same rate and come down at the same rate, which they do, a normal finding. I'm also going to test back here for any skin turgor, which is normal. Now I'm going to put my hands, I'm going to go down your back. Let me know if you have any pain anywhere, okay? Any pain?
No.
Okay, and the spine is medial, there is no curvature, and it's normal. She is not complaining of any pain, which is a normal finding. Now I'm going to palpate for tactile firmness. I'm going to put my hands on you. I want you to say 99 nice and loud, okay?
99, 99, 99, 99.
Okay, so the vibrations are equal, which is a normal finding. Now I'm going to percuss the back of the chest, and I'm going to go at it at 8 different areas. What I want to hear is resonance, which means that there's air inside of her lungs. So breathe normally, Sulema. I'm going to be palpating your back so you feel a little bit of pressure, okay? Okay, resonance in all 8 areas, which is a normal finding. All right, now we're going to examine the diaphragmatic excursion, which is the movement of the diaphragm with breathing. So I'm going to ask you to breathe in as much as you can and hold it. I'm going to palpitate until I hear dullness, which is about this area here. I'll mark it. You can breathe normally now. Okay, so about this area is the inhalation. Now I'm going to ask you to breathe everything out, all of your air out, and hold it. Breathe it all out. Okay, hold it. Okay, just about this area. So the distance between here, the exhalation, inhalation you can breathe should be 0.5 to 10 or 5 to 10 centimeters, which is a normal finding. There's a difference. That means that there's a respiratory issue that the diaphragm is having to work a little harder. Now I'm going to assess the posterior lung sounds in 8 different areas. So Sulema, as you feel my stethoscope move, take a nice deep breath with your mouth, okay? Okay, all 8 sounds are clear. There's no increase in effort noted. All right, now I'm going to examine the anterior chest, so you can turn around and look at me again. Now I'm going to go ahead and touch the front area. I'm going to let me know if you have any pain anywhere, okay? No pain? Okay, no pain noted to the sternum or the clavicle area. I'm going to assess for tactile firmness in the front as well. So I'm going to put my hands on your chest, and the same thing we did in the back. You're going to say 99 nice and loud, okay?
99, 99, 99, 99.
Okay, vibrations are equal. Now I'm going to percuss the anterior chest. Again, I want to hear resonance, meaning that there's air in the lungs. So just breathe normally. If you can look for me that way, thank you. Okay, resonance heard in all areas, which is a normal finding. Now I'm going to auscultate the 8 areas of the front of the lung. You're just going to breathe like you did when I was listening to the back, nice and deep through the mouth, okay? Okay, turn that way. Alright, clear in all 8 areas. Alright, so you can take your time breathing now. Now we're going to test for bronchophony. So I'm going to have you say 99 normally while I listen to your lungs, okay? So this will be for the back of the lungs, so if you want to face that way, so that way. Alright, that's good. Alright, so when you feel my stethoscope move, say 99, okay?
99, 99, 99, 99, 99.
Now we're going to test for eophagy. So go ahead and say E,
E,
E.
E, E, E,
Now I'm going to test laterally, say E.
E, E.
So as I move down the chest, I can definitely hear the faint and the echoing. Now we're gonna do the whispered. So you're gonna say 99, but you're gonna whisper it, okay? Go ahead. So as I move down the lungs, as she whispers, it's very, very, very faint to even, I can barely hear it at the bottom of the lungs. Alright, so that's a normal finding. So if you can turn around or you can lay down. Now we're going to move on to the heart assessment. I'm going to inspect for any heaves. As she's laying down, any heaves I could see on the left side, any visual palpitations, I don't see anything. Now I'm going to actually palpitate for any thrills, or any thrills or bruise. So my palm is going to go, can you lift your chest a little bit? Right on the bottom of the nipple. I don't palpitate any bruise or any thrills. And then I'm also going to, we're going to look for the pulse of maximum, point of maximum impulse. So that's on the 5th intercostal, mid-clavicular. So I'm going to look for the notch. Okay, I'm going to go over. This is assumed to be the 2nd intercostal. This is going to hurt a little bit as I move down the 3rd, the 4th, and approximately the 5th. And the mid-clavicular, I should be able to feel the pulsation here, which I can. And I would assess that for about 60 minutes, or the 1 minute, and we should get anything between 60 to 100 pulses, which is a normal finding. All right, now I'm going to assess the carotid arteries, so if you can look up a little bit. As I'm looking at them, I don't see anything jumping up or any extracurricular pulsation. Now I'm going to palpate lightly, if you can turn. Usually right in the bottom of the sternocleidomastoid, I can feel it very lightly, but it is there. It's about a normal, a +2. Now I'm going to auscultate it very lightly with the belt of my stethoscope. Okay, hold your breath for me. Breathe in and hold your breath. Okay, no bruise auscultated. Now I'm going to do the assessment of the heart sounds. So we're going to start with the right, 2nd intercostal, pulmonic, aortic is on the right 2nd, Erb's point, mitral, 3rd or 5th, and tricuspid, closer to the sternum. Okay, and I'm going to do the same with the bell of the stethoscope. S1, S2 heard, which is a normal finding. Okay. All right, now the last thing I'm going to assess for is the jugular venous pressure. So go look on the left side. Okay, so I can see the jugular vein. As I push down on the belly, about 3 centimeters down from the mouth of the belly, I should see a little bit of a change in that pulsation, which I do, which is a normal finding. All right, go ahead and sit up to them. Now I'm going to assess the brachial artery, which is in the AC area, and I should be able to palpitate it. And I do. 2+ normal finding. Okay, that's about it for the heart and lung assessment. Do you have any questions for me? All right, thank you for participating. That's it.
Did you
Oh
record it?
shit, I didn't.